we're back here with Dr. Rallis, and we are doing a rapid fire. I love this concept already. I got to tell you, behind the scenes, people that are in the studio and in the building, they came to us after the first segment and were like, oh my gosh, I learned this. Oh my gosh. So we know we struck a chord. We know from the number of questions we got that we struck a chord. But these conversations are so vital, Dr. Rallis. Like, this is why we're doing this. How cool is that? All right, so we get to roll up our sleeves now in the next section of Rapid Fire, talking about something I'm passionate about, musculoskeletal health. Something that, of course, I've worked in that area of expertise for 33 years now. So the first question that somebody had sent in when it comes to musculoskeletal health was, what's the number one thing people get wrong about joint pain?
Around 26 years ago, I was setting up my practice, and I wandered into the local health food store in Barrie, Ontario, Nutrition Plus downtown. I think it's closed now, unfortunately. Great store. And there was, I asked them if I could set up a booth, because obviously I didn't have any patients.
Yeah.
I had rent to pay. And
been there, know what it's like.
And there was this this gentleman that came by, almost like a healthcare heretic type guy. And he said, "You're wasting, people's time. You want to fix back pain? I'll tell you the secret." And then he took off.
Oh.
So I was, instead of being offended,
I chased him.
I chased him.
I love it.
I chased him, and I said, "Dude, you got to tell me what." Like, I may have just finished 4 or 5 years of school, but I need to know what your take is on this.
I love that.
It's the kidneys.
It's the kidneys.
That's what he said. Anyway, I don't know whether that was true at that point, and I started practicing. But that being said, the more I learned about the back, the functioning, when I learned about Chinese medicine, when we went to naturopathic, you learn about the urinary bladder channels, how it affects the back. We began to see patients, and I'll give you a great example. Patient came in, had been seeing a chiropractor 3 times a week, was not getting any resolution. When I palpated their back, I was like, this was like a steel drum.
Mm-hmm.
I said, look, man, I don't know exactly what we're going to try to manipulate. I looked at the x-rays. There was no frank pathology on those that would be sort of explaining this type of perpetual pain. I said, let's just try to calm the noise.
Uh-huh.
And in my mind, I'm thinking, first we got to calm the muscles. It comes from the inside out. If it's down the side, the psoas is likely involved. The kidney sits on the psoas. The psoas pulls on all those vertebrae very strongly. And you would know all.
Absolutely.
All of this.
Love it.
Started an IV. I think I ran 800 milligrams of magnesium with 200 to 400 milligrams of calcium. I added some taurine. This formula ultimately in the DripBar became our muscle soother.
Well, that sounds like it would be amazing.
And by the end of the drip, the pain was gone. So what people get wrong about joint pain is it's not often there.
It's not in isolation.
It's not in isolation.
You betcha.
I cannot tell you how many patients with distended bowels, because again, once you have, there's usually issues in the back, whether they're arthritis, et cetera. But again, you could look at 100 x-rays and you look at the radiographs, they could have, all varying levels of spondyloarthritic changes. And yet none of those correlate to actual pain in the patient. Yeah. So when you begin to think, especially when a patient sees it limbically, that black and white radiograph, and they see the spondyloarthritic changes in that advanced osteoarthritis, and they go, oh,
I'm in trouble.
I'm in trouble.
Yeah. I see it every day in my practice.
That doesn't necessarily correlate to function, which you see again every day.
And converse happens as well.
Right.
Where somebody is, where they're telling me they have pain and what I'm feeling is not, it doesn't match. And that's when, as a proud, clinically sound massage therapist, I know when something is out of my scope and I need to push and not make the patient concerned, but to bring it to their attention. I've seen this many times with people that actually have come in that I didn't know had cancer. They didn't know had cancer. And they're presenting with joint or muscle pain.
Right.
And I'm palpating and what I'm feeling and all the things I'm doing, and I'm realizing there's something more going on here.
Yeah, skilled touch. I can't tell you how many insights I've received from physiotherapists, massage therapists, chiropractors that knew just from skilled touch things were wrong.
Yeah.
You know, and
Yeah. From an energetic perspective, from a palpation perspective, from spending an hour with a patient, when you lay your hands on a human being and the mind and body are connected, sometimes things are coming out that the patient didn't even plan on, because that is the complexity and the beauty of our bodies. It's incredible. But what I love, and which has been my whole career, is that's how Wellness for Wellness became a multidisciplinary clinic. It was not by accident, but it was on purpose, because every time I needed to add another member to the team, because I knew I was a vital part of it.
Right.
Even when people weren't seeing massage therapy as a vital part, I was having no part of that. I'm still the proudest massage therapist you'll ever find, because I knew that by having a chiropractor and a naturopath and a nutritionist and, you know, a mental health professional working under one roof, when I felt something and I'm clinically really proud of my skills. However, there's a limit, and I know that, wait a minute, something more is going on here. And I will write a book one day, stories from my massage table, because there's many of those circumstances too. So it's that, oh yes, I become my problem, I see I have this arthritis, and now I'm debilitated. Or I've got pain, and they're assuming it's musculoskeletal, and in fact, it's not.
Right.
You can't separate the systems, people. It's so important, and this is why we can't separate and silo medicine, and why we all have to learn and grow from one another. Thank you for being a champion for people in our profession, Dr. Rallis, because you are also speaking, as do I, to physicians and change makers in our system, and it's long overdue that the value of what we do in touch is validated. So I thank you for all the massage therapists and physios and chiros out there.
My pleasure.
Okay, so what daily habit do you recommend to support spinal health?
Motion.
Yes,
But-
is lotion.
Yeah, motion for sure.
Yeah.
But I think where people sort of fall into the mistake I think that people make is not making it functional.
Yes.
So they'll just walk. And really, I'm just walking. So really, my hip flexors get tighter.
Yep.
You know,
overused.
you don't actually improve a lot of your physical motion. It'd be one thing to do Pilates or yoga or to dance or to, but you really need to move. We're naturally, everything in our society now, whether sitting, driving, eating, is all in forward flexion.
Yes.
And we're basically meant to, like, the world has one primary directive, and that's essentially to put you into the ground. So from the day you're born, you then begin this process of growing, and then the process of dying.
Yep.
And dying is essentially a flexion exercise. And so obviously, and you could look at someone's silhouette, and you would likely be able to gauge how old they are. So the more we can do in terms of extension exercises, which is to go against the intrinsic natural aging process, that is critical for every day. And that's firing our extensors, our glutes. Two things happen metabolically and functionally in terms of functional medicine. Our guts get bigger, our asses get smaller. So again, if you can, anything that you do that makes your ass more muscular, your gut smaller, makes your extensors stronger, will offset the deleterious components of aging.
Yes. You know, studying University of Waterloo kinesiology, the study of human movement, I mean, it never ceases to amaze me what movement and functional movement can do in terms of not just our ability to do everyday tasks, but the quality of our life, the longevity of our life. It is, and even, you know, from a vain perspective, the way we look. And yet we just take it often for granted.
No, and it's an exercise that we have to work on from the day, essentially from your entire adult life. It's an exercise that you really need to commit to.
Yes. Are there any early warning signs of musculoskeletal dysfunction that people miss?
Okay. I think dysfunction, I think that you could easily see abnormal gait patterns, dysfunctional movement. If you can't move, if you can't look over your shoulder, if you can't move your body in a certain way. I mean, there's just so many things that our fascia, the way our muscles are, the way our joints are, I think that there's, and there really is, you know, the origin of North America is very sort of puritanical. Mm-hmm. So there's really this, and part of this is this really hands-off component. And it's what makes, like we said, the physical medicine is so important, whether it's practice from a chiropractor, physiotherapist, massage therapist, osteopaths. This connection to the tissues is really, really critical.
Yes.
To assess those. And, osteopaths never cease to amaze me.
Oh my goodness. And energy work. Oh, it's remarkable.
Yeah. So I think that that's really an important component. And I think that there are lots of early warning signs. And a lot of these professions have very acute measures, like a chiropractor, you'll lay face down on a chiropractic table, there'll be a leg length inequality.
Right.
An osteopath will see that pelvic misalignment. A massage therapist will see everything.
Yeah.
In terms
from across the room. Somebody on the subway, I'm looking at them and recognizing.
You go, okay, so this SCM is tight. This is tight. This, so then their suboccipitals will be tight, and you're already assessing everything all the way down the chain. Yeah, no, it's amazing.
Yeah, it is, and what I love about that is when we start to get curious, even for ourselves, get curious about even just looking at yourself in the mirror to see the way you're standing. When I always say, when I would mentor new therapists coming into my clinic, and just saying, their treatment starts the minute, first of all, they call and you answer the phone. But secondly, when they walk through the door, before you ever do any clinical tests, before you ever get them on your table, it starts by watching and observing. But then it's also incumbent upon us to empower our patients to get curious, to listen to and look at themselves as well. We're so disconnected to our bodies and not hearing the warning signs and the whispers before they become actual clanging gongs of disease. And I think movement, and this is why I love the musculoskeletal system, it is the foundation of everything.
Yeah, and not just that. It's that and so much more. Like if you think about it, the primary input to the brain, our brain, the primary input is through second-order joint mechanoreceptors and muscle spindles. In other words, it's our neuromuscular system that is actually driving brain function.
Correct.
It's the reason why you could feel a certain way, go outside and run.
And feel completely different.
And it can feel completely different because you fired into the brain, and the brain is a reflexive organism. In other words, it relays messages up and then out. So that, and it's all through thalamic integration, and that integration is coming from our muscles and our joints.
Yes.
So the moment you change any muscle or joint, and it's the reason why we can have an infarct on the right side of our brain in the temporal area, and also left side cramp, it suddenly goes into spasm.
Yep.
So we would already know then, even if the person didn't have a stroke, if there was increased tone on the left side, pathological, versus the right. So if I did a deep reflex and I had a 2+ here, and I had a 3+ here, that would imply that I have a brain issue on the right side of my brain.
Right.
Missed. First of all, no one does DTRs.
Right.
No one looks at motion and is able to assess motion, but how we move, and it's the reason why I remember when I was coaching, my greatest experiences in life was coaching my kids' soccer.
Yes.
And I still see these kids to this day. They're all in their 23, 24 now. And it brings me so much joy. But I remember when they were U8, U9, U10, teaching them simple cross-crawl mechanisms that fires the brain in an appropriate way.
Yes.
Because when we don't crawl as infants, our brain actually doesn't get wired properly. So we have this urgency as parents to go, oh, Billy, get Billy walking. No, really, Billy should be crawling.
Yes.
Because crawling is dynamically such a more aggressive way to build the nervous system.
Yes.
And then from there, as we cross-crawl, then we can come upright. But if we start walking, our arms don't move the same. So our brain actually doesn't get wired properly.
And then let's talk
kids, and these are high-end athletes. This was the highest end of soccer in our community.
Right.
Very few actually ran properly. And these are the highest end athletes of our cohort and by the end of training, 1 summer, 2 summers, 3 summers, it would bring me great joy because we would go to the track and field meets. And our soccer team, irrespective of which school in Barrie and which school district, always won every single track meet because they had properly learned and were able to then progress.
Yes. So just very quickly, because we've got to take a break here in a moment, but then let's fast forward to the other end of the lifespan when now seniors and falls and fracture risk prevention and movement. How important is it for, we talked about kids, now as seniors, to continue with that type of training so that they can live well and prevent things like falls that can lead to fractures and, quite frankly, earlier death?
It's been an amazing transition.
Yeah.
You know, bodybuilding essentially came out of a counterculture, a subculture, essentially from Arnold Schwarzenegger in the 1970s. There were no weight gyms. There was no weight training facilities before essentially Arnold Schwarzenegger. Yep. If you really think back,
yep.
And then as a consequence of that, through the 1980s, you began to see, like now, you would never go to a high-performance athletic center and not see a massive functional medicine gym or a functional fitness gym.
Yep.
Right?
Yep.
And when I was in chiropractic almost 30 years ago, and we would go to gyms, you would never see a senior. I do a lot of my consulting now in the U.S.,
yep.
So I'll always go to gyms whatever town I'm in, and it's packed with primarily 60 to 75-year-olds.
So important.
And because the message now is clear.
Yes.
We need to drive muscle tissue.
Absolutely.
You know,
Absolutely.
And I think that's been for me when I witnessed that, it is such a profound shift.
Yeah.
You know, and the issue is not the seniors. It's the younger generation that isn't doing anything.
That's true too, for sure.
Because I'm not seeing them in the gym.
No, that's true. That's true.
So
because they're sitting behind their phone and their computer, and yeah, that's got to change.
Right.
Yeah. All right. We got so much more to cover. The shows with you, Dr. Steve, always feel like they go by like this. But stay tuned, because we got some more rapid fire coming your way here from PHAMCAST. We will be right back.